Joining Anne for our next session is Dr. Kevin Berry and Dr. Theresa Hawley. We heard from Kevin this morning, and fitting for our next conversation, which is childcare is economic infrastructure. Professor Berry is an applied microeconomist whose research focuses on sustainability and resource economics. He is a UAA professor of economics and admirably chairs, not just chairs, does a really good job chairing the Department of Economics and Public Policy. Dr. Hawley is an expert in the design of policies and funding structures for early childhood education and care systems that support school readiness and the well-being of children, especially those in poverty. In her role as executive director of the Center for Early Learning Funding Equity at Northern Illinois University, she partners with states and communities to create innovative approaches and funding mechanisms that support the diverse needs of children and families. Welcome, Theresa, Kevin, and Anne.
Thank you, Jonathan. So I'm excited to welcome both Theresa and Anne to be with us here today. And also Anne was excited you got to see your first moose last night. So a successful first trip to Alaska.
And a baby moose.
We ordered one up, of course. And so we're going to have this discussion now on childcare as economic infrastructure. And as an economist, I think it's really clear to see how important it is to not just working families, but employers. Our entire economy depends upon people being able to go to work. I'm also excited to talk about affordability as somebody who's paid for 3 kids to be in daycare at the same time. But it really matters for families, communities, and our nation to operate a bit more smoothly. Now, you were part of a group pulling together economists, public policy experts, and a bunch of other subject matter experts to really unpack the persistent barriers in childcare and discuss strategies used to overcome those barriers. And so about 20 of the nation's leading experts on economics and childcare gathered in October 2024, and they discussed the state of childcare in the United States and how to make recommendations on how we can improve this system. How can we do better? And so the conversation was framed around 5 unanswered questions that are barriers to moving forward and building a comprehensive system for childcare that truly meets the needs of those who depend upon it. Again, our families, businesses, early educators, and most of all our kids. Because as we've heard repeatedly today, most people don't go into childcare to get rich. They go because they love kids. And so let's learn a little bit more about the insights from that roundtable conversation, the report, and we're going to learn a little bit in this session about potential future work of the participants in that section. And so I want to start off sort of grounding the conversation. Anne, if we can start with you, can you talk a little bit about what prompted the gathering and share with us about the questions posed in those conversations and why it was so important to dig into those topics?
Yeah, I'm happy to. And with a lot of gratitude to Walter and his team, the Buffett Early Childhood Institute and Child Care of America set out last year to sort of tackle some of the big issues in childcare. And we started thinking about what were some necessary voices that we wanted to hear from, who we thought would be able to offer us perspectives at the micro level, the individual program level, but also, I think, zooming out to the system level and even to the level of our economy as a whole. What do we know about childcare? What do we know about how it powers our economy and helps families and helps businesses? Who's studying what? What are our data gaps? We just had so many questions. And let's say we were also ambitious. We were like, well, maybe we can get a group of people together and we can solve the problem. We can decide how much money we need and we can go off into the world and ask for it. And I think the conversation, we were able to bring this group of folks together and dig in on a number of topics. And while I'm not sure the conversation got us to a single solution, the conversation really did give us a chance to find points of consensus, things that across these different types of perspectives were things that we all know and we understand and we agree are true about what's happening now and where we want to go. We're also able to unpack places that we may want to study more and learn more. And I will tell you what the questions were. I'll also flag, I believe everyone got the executive summary in their bag. And so you'll find those questions on the first page. And we really focused as a group on a question 1 about parents and their choice. We were interested in what was affordable for parents and what can we do or what can we use to measure affordability. We were interested in how much cost impacts or limits parent choice. We wanted to talk to folks about regulations, cost and quality. We wanted to know what the impact of regulations was on cost, and what was the role of government in establishing quality program standards and workforce requirements. We wanted to understand whether or not demand side or supply side or both strategies were necessary to make progress when it comes to our childcare system. What was the impact of public subsidies on the market? At what scale could they influence cost or the availability of care? And what approaches could we take to really deal with the supply deficit? We wanted to understand more about who benefits and who pays, and what that means in terms of the shared responsibility we all have, empowering and resourcing our childcare system. And we also wanted to know if there were other types of policy, things like tax policy and leave policy, that could make a big difference when it comes to childcare and the change we'd like to see. I want to note something that I heard Katie mentioned earlier, also about messages and messengers. And I think one of the things that was exciting about this, getting this group of folks together, is that I think we were thinking too about building a bigger table of folks who are able to engage around childcare, be a part of coming up with solutions, and then carrying those messages back to their communities, their tables of experts, and engaging folks who are studying economics and thinking about a lot of factors in our economy as a whole feels like a really good opportunity when it comes to growing and building a table. And I think the conversation ultimately really led us to a point, like I said, of really seeing a lot of opportunity and also a lot of things we don't know and we need to learn more about, which I think we can dig in more here in our conversation today.
Thank you. And Dr. Hawley or Theresa, can you please share what interested you in participating and the perspective that you brought to the discussion? Can you give us a picture also of who else was participating and where they came from, what sectors they represented?
Sure. So it really was a group of economists. I have 20 leading economists across the country who study childcare issues. I kind of felt like I was the kid in the candy store. I was the one who was allowed to be there without just a childcare person or a early care and education person. As they mentioned, I'm a developmental psychologist by training. I've worked across the early care and education field for years in many different roles, starting out as a researcher, being a community planner kind of person for early care and education, founding a birth to 5 school, and then going on to working in the governor's office in and out for about a decade in Illinois, trying to knit together the whole system. And in that time, I think what I discovered was that it's like some people talk about when they're working on issues that they go from the high schoolers down to the middle schoolers down to the elementary, and they're like, finally I landed in early childhood and I found where I really needed to be. For me, it's sort of like I went from the regulatory system to the teacher preparation to the funding. It's the funding. We don't have a funding system for early care and education really in our country. We don't have a good way of financing it. It's why we founded the Center for Early Learning Funding Equity, to focus on the nitty-gritty of how you design a funding system that can really work to get resources out to providers in a way that is efficient and uses the taxpayer dollar well. And so for me, it was coming together with folks who study that part of the equation, how to use the resources well, how to build a financing system that's going to fund what it is that we know that kids, families, and providers need. So it was a really exciting opportunity to bring together those two parts of the equation. How do you fund it and how do you design the funding with what it is that kids and families really need?
Thanks. I'd like to start with maybe a question that sounds simple, but I think anybody who's thought about this with great detail knows it's really not. Let's talk about access and affordability. This seems to be one of the largest issues in Alaska right now. And so if possible, can we hear more about the conversation with national experts? Because as we all know, even if families can afford a spot, they often struggle with finding an available space, even if they can pay market rates. So with that in mind, Anne, can you talk a little bit about what exactly access means?
Yeah, and I appreciate that I think we've covered the numbers, right? We've heard about the situation here in Alaska. We've talked a little bit about how these are, the story is similar across the country when it comes to to supply, childcare supply. And right, the short story is that we don't have enough. And I do think there was a recognition among this group that is something we all accept, right? We are aware that there is a gap. The stories tell us that, the numbers we have tell us that. But I think one of the things that we spent some time on as a group that I think will resonate for all of you is that there's a layer of complexity under the story of supply and access that it is really important for us to talk about. And I think there was consensus. We need to do more work getting the right data to really understand and target our work in this space. And what I mean is that the access gap is being driven by a number of different factors that may be larger or smaller depending on where you are. We've heard today already about challenges if you have a very young child, that infant care is not being, may not be being well resourced in your community. There may not be available slots in particular for infant care. That can be a big part or an exacerbating factor. We heard about rural and remote locations as being places where, the supply gap, it's true. It's part of a larger trend, a trend that may be true everywhere, but it's a particular type of challenge in certain places with potentially unique solutions. We talked as a group too about things like non-traditional hours and hours of care that are and are not available. So all of these things contribute to the conversation around supply. And one of the things that comes along with that I mentioned a few minutes ago in my presentation is it is also hard for us to perfectly estimate how much care we need. So we know these challenges exist, but we don't necessarily know the full universe of families who, if they had the opportunity to enroll their child in childcare, would want to avail themselves of that opportunity. And that in some ways makes it hard for us to say we need precisely 100,000 more childcare slots. It's just not that simple. And so I think the group really had a robust conversation about all of these factors, but came around to a couple of things that we want to keep thinking more about, which is how do we really pinpoint some of these challenges more specifically? And that may in fact be on a community level, given some of these really unique aspects that shape the supply of childcare and the solutions for that supply of childcare. And that we also may, in fact, need to better understand things about demand in order to answer the question of how much more supply we need. So I think that was a very, academic response, right? Which is we need to learn more. But I really appreciated that in the conversation, there was a real recognition that the supply part of this story is critical, and that we need to be talking about what the challenges are and really digging in on them better so that we can come up with the right kinds of solutions.
So I think as a researcher, I actually love the result that we need to go learn more, because I finish every paper I've ever written with, and you need to read my next one.
Right.
But I think as well as an Alaskan, I like hearing, right, that national experts are thinking we need to learn more, because our second gut response to so many things is yes, but we're different for all these reasons. And I really appreciate the discussion, because of course, economies of scale and other things just don't happen in Alaska quite the same way. But with that in mind, Theresa, can you talk to us a little bit about some of the investments that can be made in supply or in changing demand? Because I think the insight is exactly there. We don't know how many people actually want childcare spots until they're available at a price that people can pay.
That's right. Well, I think it's important to recognize that we have a market-based system for early care and education. I think that there's this hope that because there are parents who need childcare, that people will come forth to provide that care, right? That's how a market-based economy is supposed to work, that there's a need for it, and therefore there's somebody who's willing to supply it, and they get together and all is well. Well, the problem is that parents can't afford to pay and teachers can't afford to stay, right? We have a system that has a broken business model for it. So so if you want there to grow supply within this system, just hoping that providers will come forth and start opening businesses to provide care is not going to be a very good strategy, because the economics of it don't work for them. And that's not, I have bad news for you. It's going to get worse, not better. Why do I say that it's going to get worse, not better? Well, it's because we know that the staff, you can look at staff in all low wage work across our economy, especially coming out of COVID and moving forward. The wages for low wage workforce have gone up substantially, much more quickly than the rest of the workforce. And that continues to be true for childcare providers who have been at the lowest end of the economic ladder for a long time. Their wages have gone up faster than most folks. The cost of price of childcare charged within the economy has gone up about 60% faster than the overall inflation rate for the last 20 years. And that is going to continue. It has to do with how Baumol's disease, to use a crazy economics term, but we know that the cost of childcare is going to continue to increase, because as people are able to take other jobs in the economy, especially women are able to take other jobs in the economy with increasing productivity, those wages are going to go up. And so the competition for the labor force is going to continue to increase. This is not a problem that's going to go away. This is a problem that is going to get worse. And the economy itself is not going to produce that supply. Now, that is why in the conversation with the economists around the table, there was a lot of talk about we cannot just invest in the demand side here, providing subsidies to families, assuming that they're going to be able to buy into a well-functioning market. It's just that maybe that individual parent doesn't have enough to pay for tuition. Now we're at a point where the vast majority of families cannot afford to pay for the true cost of providing that care, especially the cost that you would have if you paid the staff enough to keep a stable workforce within your child care center. So the need to invest on both the supply side, and I'm so excited to hear about the child care grants that the state is providing, investing in that supply side. That was one of the key factors that came out of this, that investing in both the supply and the demand side here is going to be critical.
So I'm looking for my other economists in the crowd. I'm not sure where Jonathan went, but I got incredibly excited when you mentioned Baumol's cost disease, because of course that is an awesome insight. So the idea is pretty straightforward. As other jobs become more productive, there it is. As other jobs become more productive, their wages will rise. And of course, that makes it even harder for people to stay within the sector. We know currently that the average wage for somebody working in childcare is comparable to somebody who, say, works at a gas station, for instance. Right? These are not high-paying careers, and talented people will be drawn out of the sector over time unless they love kids enough to be willing to stay. And so I want to, while we're on economics, I want to drop more economics terms if we can. It's getting close to midterms again. Supply and demand elasticities, right? We know that the topic of affordability is a big one. There's a reason why we keep coming back to it. And we also know that typical unfettered markets don't solve this problem. Mm-hmm. And we can frame this simply as, right, parents are willing to pay up to what they're able to pay, and they are able to really only pay for the services they get. They don't take into account the benefits to other people. And what's the optimal amount of childcare, knowing that there's all these other benefits to society, from a larger workforce, greater women's participation in the workforce, the long run benefits, everything else we've heard about today?
Yeah, I really think I want to make sure that we all have an opportunity to understand this concept and to be able to talk about it as part of the case we make for widespread support for childcare and early learning. When you have something like childcare, which provides benefit not only to the individual parent or the child, and the child care provider supplies it, when there are benefits that go beyond just that individual consumer, you have something called a positive externality. And I really appreciate that you've just outlined a number of what those positive benefits are, right? We see it when our colleagues are able to come to work every day. We see it when our neighbors have a safe place for their kids to go. We see it when kids show up ready or more ready for kindergarten than they would have been without access to high quality childcare. We see it in long-term returns in our workforce and the ability to prevent additional costs for individuals later in life because they had a better start early in life through high quality early learning and childcare. There are a lot of things we gain from having childcare and early learning available. And if you just reduce the market to the consumer and the supplier, you will not get an amount of childcare that captures or accommodates all of those benefits. They're only going to be exchanging their good at a price that works for them as an individual consumer. But we have a solution to this problem, right? We can intervene in that market and we can figure out ways to both make it more affordable by lowering the sticker price for families and make it more available so that we reach equilibrium at a different place, at a place with a larger amount of childcare being provided and a benefit that we are all then receiving. We are then capturing those benefits by intervening in the market with all of these different tools that we have available to us. And we talked about this at this convening because it's really important for us to understand that it is true. You can tinker with those individual actors in the market, but there's also a lot of value in making sure that we're making some wholesale changes and investments too, because there are wholesale benefits that we are all getting from childcare and early learning. So I will say, Kevin, you may want to adjust how I just explained that. There may be things you want to add, but yesterday you also said something about equity that I want to make sure we capture here, which is also that, a market may not allocate childcare in a way that is equitable. That's not how markets work. They're designed to be efficient. There are people who there haves and have-nots in markets. And I do think that it's really important for us to consider too, what we want the delivery of childcare to look like, who we want to have access to childcare, and the reality that we may need to intervene to make sure that those things happen. They don't just happen magically. They happen when we're deliberate about policy and deliberate about investments.
And I want to follow up on that to say that we as a society, all of us need for all children to get what they need so that they grow up able to. I know someone was saying, don't talk about what it is 18 years from now when the person shows up in the labor force. But I'm sorry, that's there too, right? What families are able to pay for may only be what I would call catch as catch can care. Whatever we need to piece together so that we can get through week to week to be able to work, to be able to make sure our kids are at least kept safe and healthy. But what society needs is for that kid to get the early learning experiences that they can only get in that 0 to 5 age range, right? They need them to have that language exposure, the early learning activities, the really safe and stable setting that for their development. That we need every kid to be able to have that. And if every family cannot afford to pay for the child to receive that, instead, what society is going to get is a lot of kids who have early learning experiences that are much more disrupted. And as they come into elementary school, they're not going to be as ready to succeed as they get older. They're going to see the many different costs that brings to society. So the society as a whole needs more than what parents are able to invest in their kids. We know this in the K-12 years. We know that if we put it on parents alone to finance their kids' education, that we would not have an educated workforce in the long run. Well, all that learning and development, and it happens in that birth to 5 years. If families are not able to make that investment directly themselves, it's society as a whole who ends up paying for that.
Yeah.
Wonderful comments from both of you. And I think it really is important to talk about what some of these externalities are. So I appreciate you bringing it up, right? We know that on average, people would like to have more kids than they actually have. Emily Oster at Brown recently wrote about how one of the major barriers to that, of course, is access to childcare, because parents make a consideration of how much it's going to cost to have a second, third, or fourth child. We know, of course, also that there's externalities in the short run. When we talked earlier about the business perspective is important, that something like 70% of absenteeism can be tied to childcare disruptions. The scariest phone call I ever get is that I accidentally saved the phone number for my children's school as Turnagain Nurse. And so every time the phone rings in the morning about any announcement they're making, I'm like, oh no. And also, I was thinking a lot of the statistics I've been citing come from a research report from McKinley Research Group. And I know that they do work as a team, but part of the reason those reports exist, of course, is that my household has childcare and my spouse works there and is able to work on those reports. So we can think about these forms of productivity that show up because people have reliable care. And I think that's incredibly important that they show up in these long-term, 13% return on quality childcare that we see from Heckman's work. So the very short term, people can reliably show up to work the next day. But with that in mind, I want to zoom back to affordability one more time, because as somebody who has in the past paid $3,600 in 1 month for childcare, I will never not remember that experience. I sometimes point to my kids and I go, "You're the boat that I don't own." So let's hear more about the questions the group considered around affordability. What points came up at the roundtable that you think are important to consider? And what can parents afford? Should I blame my children for not owning a boat? Is that fair? And how would you determine what parents can afford? And would you like to go first? Or Theresa?
Teresa, you want to kick us off? Well, I think it's really interesting thing to try to think about. We talked a lot at the roundtable about understanding these elasticities. Like, at what point does somebody decide that they will leave the workforce because they cannot afford childcare? I think a lot of times it's talked about around this percent of family income. I don't know about you, but that's not how I thought about it when my husband and I were thinking about childcare. Like, we looked at the lower income spouse, that would be me. And we looked at my income and said, at what point does it not make sense for me to be working anymore? At what point does work not pay for me as the second parent in the family that might be working? And so I think there's a lot to this we don't know or understand. I think our shortcuts of saying like percent of family income are probably not capturing very well what it is that goes into the real decisions that folks make as they decide whether it's affordable or not for them to have childcare. And certainly in these questions of like, is it affordable for me to get the childcare I would really like to have for my child that has the enriching and educational experiences for my child versus, like I said, more kind of catch can childcare.
Yeah, and I do want to touch a little bit more on this idea of trying to benchmark affordability and what it helps us with and what it doesn't really do justice to. And the group that gathered spent some time first talking about a benchmark that exists right now when it comes to childcare affordability. And that is that in current federal regulations, states have to ensure that families who are receiving subsidy do not have a copay that is more than 7% of their family income. And while we should all keep in mind that we have a very small portion of families across the country that are accessing subsidy, and it is fewer than the number of families who are eligible for subsidy. And of course, that is even less than the number of families who likely need help to afford childcare. But we just acknowledging that within the system we have set this benchmark. And the 7% number came out of some efforts over a decade ago to start to move us in the direction of having some limits on the family copay side of the equation. To say, states, when you're setting up your subsidy system, keep in mind that it's not really a meaningful subsidy if it doesn't cover enough of the price of childcare for a family to use that subsidy. But 7% is also not perfect. I think we all know that it not only is 7% or any percent of your income not really how you're thinking about your monthly bills. It is also not clear that 7% is somehow a magical affordability threshold for every type of family, everywhere, every family composition, and every type of care setting that they may need or want to pursue for their kids. And that is, I think, a real challenge around benchmarks. Is we sometimes need to start somewhere with saying, well, 7% is probably better than 20%, right? And moving in that direction and having states move in that direction with their systems is a positive I think, a positive thing for families over the past 15 years. But it's not the same as saying that we have magically reached affordability. And I think this group that gathered talked a lot about, is there a way that we could get to a number? And is it a single number, or is it a type of calculation that gets us to affordability? You'll see in the report, if you look at it, that there was a discussion of some of the work to sort of do family budget estimations or calculations. So average this, average that, where does childcare fit in? Where does a family start to gain enough room to cover some of the childcare prices? And is that what affordability would look like? This may be familiar. I mean, there are some programs where we look at the overall family budget and we think about how that fits in. That is something that we could consider spending more time on, is what would it look like to talk about childcare as a component part of a family budget, and where and how does it become more or less affordable, and how do you use something like a subsidy or a voucher to make up the difference? But that certainly becomes very specific, and in some ways it doesn't work as a threshold of affordability. And of course, I think you saw that there is also a choice here, and New Mexico is an example of a place that is making a choice. And that choice is to have childcare be no copay for families that are eligible. And they're, eliminating the income threshold. It's just for families that are working or in school. So I think all of that really came out in our conversation together when we talked about affordability. It wasn't a no on 7%, but it was also, I think, a lot of questioning around whether or not that benchmark is serving us well, or whether it should be the only benchmark that we use around affordability.
So I think the trouble is we have too much to say to each other. And I think we could easily talk about the economics of this until the end of the summit, and probably well beyond that. But I want to make sure we have time for audience questions as well. So there are folks running around with microphones. If you have a question, please raise your hand. And if we can, I want to do a 30-second lightning round while we wait for the first question asker. What is quality and how do we measure it? We've covered 2/3 of Thread's sort of mission of accessible, affordable care. What is quality care on top of that? And please also, if you have a question, raise your hand and someone will come find you.
There is so much debate about what is quality. It comes down to really the setting that the child is in being stable, responsive, caring, educationally enriching. So having early learning activities. It comes down to teachers talking with children directly, each and every child in a setting. And some of the things that are quality don't necessarily cost any more money than not quality. It's about those loving, kind relationships. But they are so much more likely to happen if you have the things that do cost money, like favorable ratios, so fewer kids per teacher, teachers who are well qualified for what they're doing and well skilled in what they're doing. So there's a lot of parts of quality that maybe don't cost more money, but there's a whole lot of quality that does, and the things that the structural features that set a program up to be more likely to be the kind of high quality setting that supports kids. That's a lot of what we do at Selfie. That's what we call our center. A lot of what we do is make that link between quality and cost.
And I would just underscore the workforce component of it. And I really appreciate that today we've already had a chance to really dig in there, talk about it, understand more about the research. And I think that that's a place for me where the real attention needs to be paid, is to make sure that our workforce is strong, because that really is what makes for higher quality environments.
Okay, and so I think we've got a question in the back. Margot, what would you like to ask?
Yeah, hi, I'm Margot Fliss. I'm a Thread board member, and I wanted to make a comment and then follow it up with a quick question. I was at the Child Care Aware conference a couple years ago, and there was a gentleman from the Women's Labor Bureau that was speaking about that 7% number. He had worked on that study and was like, that's not the bane of my existence, but it's the bane of my existence because everybody's like, nope, you put a stake in the sand at 7% and we're holding you to that. And his point was that's not really affordable for a lot of families. So I was just curious if there's work happening. You had mentioned there's a couple of different ways to look at it. Are there states who are starting to look at that we could kind of be following along?
I would just say that there are a lot of states that are starting to look at, maybe it's not just with a subsidy voucher that we can help get to more affordable care for families. When we're getting to a place where the vast majority of families are not able to pay what it would cost to do high quality care, then maybe individual parent by parent vouchers are not our best way to invest in this. So subsidizing the system itself, like a lot of those wage supplements, things like that, are starting to be some of the mechanisms by which states are thinking about investing in.
Yeah, I really appreciate that, because I think it reminds us that just sort of continuing to have a system where we pass prices along to parents and then we try to give them a little bit of money to help is really not the approach we want to see to strengthen the system. And I do think that while New Mexico is moving in big strides, we do have a number of other states, and available on Child Care of America's website and also from the Department of Health and Human Services, you can see the different subsidy amounts that states are putting out there. We had a lot of states during the pandemic essentially eliminate family copays, and it worked. And one of the things we know about what happened with child poverty and during the pandemic is between the child tax credit and our investments in child care, we saw real reductions. I just think that's something for us to come back around to, is when there are resources, we do make the choice to do things like make childcare affordability more real for more parents. So it may not be about a literal threshold. It may be about moving towards that goal.
Hi. Given the issues you've been talking about, including people who qualify for subsidies but don't access them, and these thresholds, can you talk about the sort of philosophy behind universal approaches like New Mexico, or like Zoran Mondami is proposing for New York City, versus using means-tested programs?
Yeah, I mean, listen, I think what we're really talking about here is there scarcity or not, and about whether and how we use our resources. And so I do just want to name that is we can, philosophically, we can talk about, what's right and what would work and what would not work. But a lot of what you're seeing is that there are places where there is a will to make the investment. And then when you ask yourself what would be best for children and families, what emerges is that if you can eliminate some of those barriers to access, you do actually contribute to better outcomes. And if you can make that choice happen, it can be worthwhile. Now, there are steps along that journey. And I really want to name that, is that you don't have to go from today to fully universal. And a lot of those steps make a really big difference for a lot of people. So you can look at your rates to make sure that you're covering the full cost of care when it comes to your subsidy program. You can start to look at and evaluate, and it sounds like that's been happening here. What does the cliff look like? How penalizing is it? What does that mean? You can start to reduce those copays, and then you can start to increase eligibility, and then you can make some foundational investments so that you aren't just doing in prices. You can start to do those pieces, and at many points along that journey, I think you get to a better and stronger system. And one of the economists who joined us at this event was speaking at the conference that we held at Child Care of America 2 weeks ago, and she said that one of the things she worries about is that people see an example like a New Mexico and they almost feel paralyzed, right? Well, if we can't do that, we shouldn't do anything, because universal is the correct thing to do. And I just don't think it's that simple. And I think a lot of the conversations we had at this event and at a number of tables I've been at have been about, charting a course towards some of these goals, and not necessarily making perfect be the enemy of good. You can make progress on these things, and we know what the levers are that you can pull.
And I also like to say, we've got some pretty good evidence that not every family or childcare provider wants to engage in a subsidy voucher kind of system, right? One really interesting example of this comes from states who have implemented eligibility for childcare providers themselves, so that the subsidy, no matter what your income, you can get the subsidy if you are teaching in a childcare setting. So it becomes some states have done this, and so it becomes sort of an employment benefit for that provider. What those states have almost universally found is that many, many teachers then go on to the subsidy system who were already eligible for childcare subsidy. They did not see themselves as somebody who should be eligible for childcare subsidy. They did not apply for the voucher previously. You're talking about low uptake rates in the state. Part of this, it's real. There is a stigma. There is just a sense of like, maybe that's not what I want to do. But when people see it as something that is an employment benefit, they're like, oh yeah, sign me up. I'm a child. I should get that. And the rates of participation soar. To me, that starts to indicate, and also we see that like these childcare grants, the foundational funding that's being provided to programs in many different states, including US, the participation rate of providers in those grants is enormously higher than the participation in the subsidy system and being willing to accept vouchers. So there is something about the way people are behaving in the field that shows us that maybe this demand side of giving parents vouchers and support is not maybe the best mechanism by which to invest into this system. Giving more of that foundational funding to the field may be better.
I think as a researcher, it's wonderful to again hear that I think this means that there's a need for more research and a better understanding. It's a really good time to be in research. And I appreciate you guys bringing up how complicated this is, right? When we think about universal benefits, making it more likely that there's actually uptake, whereas we know that the benefits are probably largest by targeting benefits to lower income kids, where the gains are going to be the largest, and there are these trade-offs between willing to participate in programs versus the effectiveness of those programs. And it's just not easy. And I think it's worth, again, celebrating some of these incremental wins when we talk about solving the problem entirely or just making progress like HB 95 and 96. So again, thank you, Representative, for your work on that, because those small wins matter. And so with that, I'm getting a sign that we're getting pulled off the stage.
Yes.
Good to see you again, Jonathan. But everybody,
If I had a giant hook, it would be coming for you.
please take a moment with me to thank Ann and Theresa for joining us and having this great conversation.